Problems. Namaskar, I welcome you all to the Ashtaang Chikitsa webinar. My name is Rachna Bothra and I'll be your host for today's webinar. I'm a part of an organization called Avisa Healing and Fitness Private Limited. In today's webinar, we will present to you a unique therapy for curing neuro musculoskeletal problems that you or someone in your family may be suffering. Just a sec. I'm so sorry. Anilji, is the screen visible?
Yes.
Okay, thank you so much. So I welcome you all to the Ashtaang Chikitsa webinar. My name is Rachna Bothra and I'll be your host for today's webinar. I'm a part of an organization called Avisa Healing and Fitness Private Limited. In today's webinar, we will present to you a unique therapy for curing your neuromusculoskeletal problems that you or someone in your family may be suffering from, but have not yet found any permanent relief despite spending a good amount of money and time on various treatments. Ashtang Chikitsa can also be used as a preventive method so that you keep your internal organs functioning at their optimum levels. Are your doctors telling you your problem cannot be cured but will only have to be managed? Organs do not regenerate. Today is the day that you will come to know you may not have to take medicines lifelong to just manage your disease. Your problem can definitely be cured. Organs can regenerate. Now, I'd like to introduce you all to Swami Sriraj Vibhuji, a rare Kumbhak yogi. Swami G has been transforming lives of thousands of people who have not found any relief even after years of using allopathic medicine. He's taken people out of chronic diseases like thyroid, BP, heart, diabetes, and even life-threatening diseases like cancer. Who is this webinar for? A very, very important question. For people who are tired of temporary treatments and are looking for something natural and permanent, which is going to relieve them of their current health issues. For people who want to take charge of their health in their own hands and are willing to work on themselves to come out of their health problems. Reversing neuromusculoskeletal problems with Ashtaang Chikitsa, freedom from pain and medicine. Ashtaang Chikitsa can heal. These are the commonest problems that we see amongst Indians and the people from other countries as well. Knee pain, lower back pain, hip issues, pain in the leg, drop foot, spine-related issues, slip disc, disc bulge, weak spine, spondylitis, frozen shoulder, drooping shoulder, tennis elbow, rheumatoid arthritis, osteoarthritis, osteoporosis, dislocation, neuropathy, or the nerve issue. Ashtang Chikitsa can further heal certain very, very chronic problems like muscular dystrophy, multiple sclerosis, TMJ disorder, varicose veins, psoriatic arthritis, Ehlers-Danlos syndrome, spinal stenosis, myasthenia gravis, Bell's palsy, cervical spondylosis, carpal tunnel syndrome, ataxia, Guillain-Barré syndrome, AVN, Alzheimer's disease, dementia, glaucoma, excuse me, vertigo, ankylosing spondylitis. All these diseases that we just talked about are degenerative diseases, which means that the organs are becoming weak. So a long-term or permanent solution is definitely possible if we can somehow increase the regeneration factor of the body. But no medicine can regenerate the organs, be it allopathic, Ayurvedic, homeopathy, or any other medicine. In today's webinar, we will discover the one and only method that can regenerate the internal organs. Let's hear from Swami Sri Raj Vibhuji. Please pay attention to what he has to say about the human body and the diseases, because you will not find this information anywhere else. Through his knowledge, thousands of people suffering from chronic ailments have transformed their lives completely. It can change yours also. Thank you so much for listening to me patiently. Now I'd let you know how we are going to proceed in the webinar. After this, you're going to listen to the recorded video of Swami G, where he will be explaining in details how breath works on your body, how it builds up your strength, and how smoothly you can come out of your health issues without any external intervention. After that, we are going to have somebody live who's going to share his or her journey of Ashtaang Chikitsa. After that, we will be sharing the program details. Last but not the least, we will be answering each and every question of yours in the limited time possible. So kindly take your virtual seats and let there be no disturbances from children, pet, etc., so that you can get an insight on how the human body works. Namaste. Over to Anilji to share the video.
Namaste to all of you and good morning. Am I audible? Am I audible? There is nothing harm in giving a little smile. You'll feel good. Isn't it? Smile has become rare in the world. So, what we are doing? We are doing Kumbhak Chikitsa or Kumbhak therapy. Anybody who has heard this name Kumbhak before? Have you ever heard this name Kumbhak? People into Yoga Kalachara, they might have heard this word Kumbhak. But what we are presenting is a part of Ayurveda, not yoga. So it will be a little different, right? This is a part of Ayurveda. Now to introduce you to Kumbhak, are you doing Kumbhak in your daily life? So let's start from there. Anybody and everybody cannot do any function without Kumbhak. So let's understand Kumbhak first and let's see what can Kumbhak do in your life. So anybody and everybody cannot function without doing Kumbhak. So let's do an experiment, right? We'll do an experiment. And you have put your cameras off. I don't know whom I'm speaking to. It's when people gather together, it's an opportunity to actually see faces and meet people. And you don't know tomorrow we'll be there or not. Can anybody guarantee? So enjoy your today. If possible, put on your cameras. Clasp your fingers. Clasp your fingers. And pull hard. Pull hard. As hard as possible. How you creating the strength of pull? Relax. How you are pulling. How you are pulling. Lot of things might be coming to your mind. Using the strength of your muscles. Using your conviction, using your mind or whatnot. But you are not looking at the right point. So let's do it again. And wherever I am indicating, look there. Let's do it again. If you do the experiment, you will know what I am talking about. So everybody should participate. Pull hard. And see, the more hard you want to pull, the more you have to hold your breath. Yes or no? The more hard you want to pull, the more you have to hold your breath. Can we now push? Can we do a pushing experiment? Push hard. And see, the more hard you want to push, the more you have to hold your breath. Yes? Yes? Now pick up a point in front of you. Pick up a point in front of you. A small object or a point in front of you. And try to focus without distraction. Focus on that point. Focus on that point. Become absolutely still and focus on that point. the more focus you want to create, you'll see your breath will become shallow and it will hold up. You can relax, I don't know if you had breakfast or not. You had breakfast? You had breakfast, okay. Just remember clearly with your closed eyes. Remember clearly in detail what kind of breakfast you had in the morning. Close your eyes and try to remember in detail the colorful imagination. See, even if you have to remember, you have to hold your breath, and then your remembrance becomes better. Okay, relax. Somebody talked about dementia. What is your problem? Why you are not able to remember? Because you are not able to hold your breath. Now, if you have to balance yourself, stand on one leg, or somebody is pushing you. You want to stay on the ground. You want to hold the ground. What do? What do? Somebody wants to push you and you want to hold the ground. What do? You hold your breath. Yes. You want to stand on one leg. Create a balance. How do you create a balance? You hold your breath. Right? How do you dance? How do you sing? How do you walk? You hold your breath in variable proportion behind. Don't notice it. You don't notice it. You hold your breath in variable proportion behind. Walking, jogging, yoga, Zumba, aerobics, whatever you do, household chore, whatever you do, even you have to get up from the chair. What did you do? You held your breath for a short time, isn't it? Can you do any action without holding your breath behind? You can't. The only thing is you are not noticing it. You are not noticing it. So action in life happens because of Kumbhak, the breath hold that you did in variable proportion, at variable point of time, in variable mode, sitting, standing, lying down. What you are doing? You are holding your breath, or you are doing Kumbhak. You are doing Kumbhak to do an action. Now, in all your problems, in neuro musculoskeletal problems, what is the basic issue that you have? It is inability to do action properly. Yes or no? Any kind of neuro musculoskeletal problem, what is the basic issue that you are suffering from? You are not able to do action properly. When you do action, either you feel pain, or you do not have that kind of strength, or you do not have hold over your limbs. Yes? So let's understand the basic problem. Only if we understand the basic problem and we connect it with something which is practical, you can come out of the problem. Otherwise, in the last 100 years, tell me one person who has come out of arthritis by taking medicine. One person who has come out of rheumatoid by taking medicine. One person who has come out of Parkinson, dementia, and so on and so forth, osteoporosis, by taking any kind of medicine. We do not have even a single proof in the last 100 years that we have come out of these problems by taking medicine. And I'm talking about chemical medicine, allopathic medicine. Now, one more commonsensical question. Would you put diesel into a petrol engine or a petrol vehicle? No? Not, never? Never. So, tell me, was your body designed for a chemical intake? Your body was not designed for chemical intake. For the vehicle, you use your common sense. For human, your body, where does this common sense go? If your body is not designed for chemical intake, your body is not going to become better or healthier by chemical intakes. So where is the proof? All these diseases, are they increasing in the world or decreasing in the world? It's all increasing. All the chronic diseases are increasing in the world. Is there a single diabetic patient who has come out of diabetes by taking medicine in the last 100 years? One blood pressure heart disease patient? Do you know blood pressure and heart disease has become the #1 cause of death? Thyroid patient? Have we been able to cure any thyroid patient? Autoimmune disorder patient? Cancer is increasing at the rate of 12% every year. Arthritis, rheumatoid, and you listen to all those problems. Neuro Musculoskeletal Problems. Even a single patient hasn't been able to come out of these problems by taking chemical medicine. In fact, the data says these all problems are rampantly increasing in the world. So it is high time that we look in some other direction. We think out of the box. With a different kind of a false narrative, you are not going to become better. You start with one medicine, and how many medicines you have come up to? Now, if we understand this body, we can understand how we can reverse our problems. The whole purpose is to reverse these problems. So one example, the core key of how to reverse your problem, I have given it through an experiment. So whenever you make effort, you use Kumbhak. Now effort happens with your neuro musculoskeletal system. You use your breath hold to integrate your neuro musculoskeletal system to make an effort. Right? So if your neuro musculoskeletal system do not get the proper regeneration and degeneration, you will not be able to make right effort or proper effort. What I am talking about is regeneration in the body, new tissues forming, and degeneration of the body, old tissues going out of the body. This is a continuous process that is happening in the body. So let's see, is this regeneration and degeneration, the balance of this has deviated in the world? So what is your knee problem? What is your knee problem? The regeneration of cartilages are not happening. Myelitis, or what you call as myopathy, muscle loss, muscle weakness, what is that? The regeneration is not happening properly. The arthritis factor also happens because of lot of toxins at the joint. The degeneration is not happening properly. Toxins are not getting removed from the body properly. So this regeneration and degeneration is something that we have to get into balance. How many people you see are overweight or underweight in today's world? This problem is huge in the world, isn't it? Either the people are overweight or underweight. To maintain the right weight balance has become difficult in the world. Yes, isn't it? Yes. What is the basic problem? It is the imbalance of regeneration and degeneration. In Ayurveda, the rate of regeneration and degeneration is called as Vata. There is a word for it in Ayurveda. The rate of regeneration and degeneration is called as Vata. The energy of regeneration and degeneration is called as Pitta. And the material management in regeneration and degeneration is called as Kapha. So Ayurveda says, if there is a deviation of Vata, Pitta, Kapha, you will get into Neuro Musculoskeletal Problem. I am generalizing it. Any kind of neuromusculoskeletal problem comes under what I am describing. So, I will describe it in another way also. But let's first talk about regeneration and degeneration. Now, this regeneration and degeneration depends upon what? It depends upon your body's ability to utilize food. What you term as metabolism. Your body's ability to utilize food. The food that you eat, the body should be able to utilize it to create new tissues, to create muscles, to create bone density, to create nervous system or nerves. Now this metabolism has gone weak in the world. What is the proof? Do you know neuromusculoskeletal problem is a metabolic disorder? Do you know diabetes is metabolic disorder? Do you know heart disease is metabolic disorder? Thyroid is metabolic disorder. Cancer is metabolic disorder. Any kind of chronic disease has a metabolic disorder in its core. even your immune system disorder, autoimmune disease and other immune disorder, metabolism is a precursor to any immune system disorder, and they work inversely proportional. If your immunity is high, your metabolism will come down. Your immunity will go high when your body will get into some kind of risk. Do you think when you put a chemical inside the body gets into risk? Your body is not designed for chemical intake. When you put a chemical medicine into your body, the body gets into risk. It enhances, increases the immune system and downplays the metabolic system. All metabolic disorder is increasing in the world because of chemical medicine intake increasing rampantly in the world. One major factor of why you have got into neuro musculoskeletal problem is from childhood you are taking in chemicals or pushing chemicals inside the body. In the name of vaccination, in the name of doing something good to your body, you are actually doing a criminal act with the body. And obviously, the health quotient of the world cannot increase because of your destruction or destructive activity on your own body. I'll give you one example. All of you must have some quantity of medicine at home. Everybody has paracetamol, yes or no? You have paracetamol or some kind of painkiller in your home, in your first aid box, right? Now I'm just trying to make you understand. It is very important that you get it right. If you understand the whole thing clearly, then only you will be able to take a right decision towards correcting your system, isn't it? What you do in your life is your freedom. But you must get it clear in your head first. So, there are two kinds of painkillers. One is called as steroids. The other category is called as NSAID, non-steroidal anti-inflammatory drug. Your paracetamol, nimesulide, there are many, ibuprofen, aceclofenac, diclofenac, all these comes under NSAID. Now they do this pain relieving activity by inhibiting a biocomplex called prostaglandin. Prostaglandin inhibitors. They are called as prostaglandin inhibitors. Now prostaglandin, what it does? Prostaglandin activates the regenerative factor in your body. When you are taking a painkiller, you are saying, I don't want new tissues in my body. When you are taking a painkiller or you are trying to put down your fever, you basically are saying, I don't want regeneration in my body. So what will you get? When you take paracetamol, what will you get in the life? Arthritis, rheumatoid, myasthenia gravis, dementia, tendinitis, carpal tunnel syndrome, and so on and so forth. Because these are all degenerative disease. What will your body do if it has to kill a virus within itself? Everybody of you must have gone through some kind of cold and cough, viral flu or corona. In your life, you must have gone through all these cold and cough, viral flu, some kind of a viral infection. What happens when you get cold and cough? What happens first in your body? The body raises the temperature, what you call as fever. The body raises the temperature. By increasing the temperature by 5 degrees, the virus will get killed. But the moment body raises temperature, what do? Paracetamol. You are saying, I don't want you to kill the virus. So you want to treat yourself by taking medicine. If you don't take medicine, the viral will go off in 3 to 5 days. But if you take medicine, it will go off in a week to 15 days. But we are intelligent people, you know. We want to give credit to some medicine. So a week and 15 days is okay. Because if you would not have taken the medicine, you would have been treated in 3. You would have become well in 3 to 5 days. But we are intelligent people and we have to give credit to the recovery to some medicine. We choose a longer path. Okay, we'll become fine in 10 to 15 days, so we take medicine. Despite of your taking chemical intake, you are still living and breathing. Just pat your back, appreciate your body at least. With so much of torture, you are still living. This body is such a resilient entity. You have tried to kill it in every possible way, still it is living. It's a miracle. It's a miracle. You are trying to stop or activate every function within yourself, within the body. The body knows how to survive, how to do action. Are you doing the heart activity inside the body? Your own body? Are you doing it? Are you conducting it? Are you conducting any function inside the body? Doing the heartbeat? You are not doing it. You don't know how it is happening. Liver function, are you doing it? Kidney function? Neuro function? No, you are not doing it. But you feel it is my right to stop any function inside the body or deviate any function inside the body. You take in a chemical. These chemicals are called agonist or antagonist. They either stop a function or deviate a function. So we have tried to kill this body in every possible way. If it is still surviving, it's a miracle. It's a miracle, isn't it? You must at least appreciate the sturdiness, the robustness of this mechanism, which is human body. Okay, so I just gave you a hint of what we are doing. Don't go on narrative. You all are intelligent species. Use your wisdom rather your information or education. Please use your wisdom. You are all intelligent people. don't always agree to what somebody says. There is a wisdom of life there which is alive in you. If you think from that wisdom, you can see this very clearly. So, Vata Pitta Kapha. Now I'll talk about Vata Pitta Kapha in a way where we can actually correct it. So, the whole system or any living entity functions on three factors, which is Vata Pitta Kapha. Of course, I described it in a different manner. Now I am describing it in a different manner. First, the most powerful aspect which is needed inside your body is pressure. Pressure. Because action always happens in pressure gradient. So even if the cloud has to pour somewhere, you have read this rain cycle. From the sea, the water has to rise and become cloud. Then the cloud moves from high pressure to low pressure zone and pours down there. So even the cloud movement happens in a pressure gradient. From lower down in a tree, the tree has to pump water and mineral and all the food up. That happens in a pressure gradient from a high pressure to a lower pressure zone. In your body, food moves into your cells and out of your cells in a pressure gradient. You have to create an osmotic pressure. Your body has to create an osmotic pressure of the tissues and cells for proper intake and exchange of materials and gases and water. So your body functions in the right kind of a pressure ecosystem or architecture. If this pressure architecture goes down, your organs will not function properly. The absorption will not happen properly. Metabolism will not happen properly. Exchange of water, gases and nutrients will not happen properly. The right kind of pressure has to be generated in the body. Now I'm giving you one more example and proof to understand this. Just imagine your grandfather, grandmother. Just imagine your grandfather, grandmother. If you compare your grandfather and grandmother with yourself and think of the same age line, at the same age, what is the difference between them and you? One common difference. You can say they were not into these many problems. Yes, but what is that factor because of which they were not into all these chronic disease? They could make more effort with their body. You can't make that much of an effort with your body in comparison. They could do lot of things at a particular age with their body, make lot of effort. At the same age, you are not that efficient comparatively, isn't it? What we have lost through the ages, we have lost the capacity of effort making, of making effort. Our capacity of making effort is less than their capacity. So what you have lost fundamentally, if you have lost effort making ability, you have lost the capacity to hold your breath, because you make effort by holding your breath. Yes or no? Are you getting it? Are you with me? We have done an experiment. If somebody has joined later, they can watch the webinar again, because it is very important that you understand things. Only then your life will become better. It will not become better with ideas and narratives. So what you have lost in 2 generations, the ability to make effort with your body. That means you have lost the ability to hold your breath. Do you want to improve your life or not? Do you want to improve your effort making ability or not? Do you need a Kumbhak practice or not? Let me tell you, this is the only way through which your life experience, the quality of life will improve. There is no other way. If you think some medicine can improve your life, you are daydreaming. It will never happen. You must increase the body's ability to make effort. Now, what is metabolism? What is metabolism? The body's ability to utilize food. Now, take an example from your life's experience. You know, in your life, whenever you did lot of activity, that day you get lot of hunger. You become more hungry, isn't it? The more you become hungry, the more the body utilizes food. So with lot of effort in your young days, whenever you did lot of effort, lot of work, you became more hungry that day, you ate more food and your body utilized more food. How did you do that activity? Whatever activity that you did, by holding your breath in variable proportion. When you did Kumbhak, your body's ability to utilize food and your hunger increased. So Kumbhak increases metabolism. And we have lot of proof of that. There are thousands of people who have done Kumbhak and they have improved their metabolism. Their regeneration capacity has increased. People with lot of degenerative disease, they have come out of those diseases. People have come out of degenerative neuro disease also. Paralysis. People have come out of paralysis. Drop foot, myasthenia gravis, lockjaw, frozen shoulder. And we always say, even in the case of Parkinson, there is only one way in which you can improve your condition, and that is by doing Kumbhak. So first thing first, your metabolism has to improve. The moment your metabolism improves, the autoimmune factor of the body balances out. So whenever you take a pill or take some food which is deviated, genetically modified, hybrid, processed, inorganic, your body gets into risk. So it increases the immune quotient, the immune factor, the metabolism goes down. Whenever you take medicine, the immunity increases, metabolism goes down. We have deviated the environment also. Even with your breath, when you are breathing, your immune factor is trying to push up and your metabolism trying to go down. No doubt, all the metabolic diseases are on rise. They are becoming epidemic. So first thing first, you have to increase your metabolism. And that will happen with Kumbhak. With Kumbhak, you can increase your metabolism, and you'll see the moment you increase your metabolism, the autoimmune factor which is there inside the body, it goes down. it balances out itself. So even rheumatoid arthritis or any kind, Hashimoto or any kind of autoimmune syndrome in the body, it gets balanced out. It can become, you can reverse those things by taking in steroid. You will get into more and more problem. You should only take chemicals in a very emergency situation and for a short period of time. You should only take medicine when the condition is at a very high risk, and that too you should take it for a short period of time. Then you should ideally work upon the body in such a manner that your body's recovery strength, regenerative strength, metabolic strength, immunity, hormonal balance, detox strength, they improve. And the body should be able to take care by itself, because your body is designed for it. It can take care of anything by itself, but that strength has become very weak. So by Kumbhak we can increase all those strengths. So you should be working upon the body. If you start doing Kumbhak, you should work upon the body for at least 6 months. For 3 months continuously, if you work, you can reduce 50% of your chemical medicine and take some alternative natural medicine. After 6 months, you decrease that 50% of chemical also to null. 100% of what medication you should be taking has to be natural, without any side effect, those kind of medication. Herbal. After 1 year, no medication at all, because your body is designed to take care of itself. You don't have the recovery strength. That's what we will increase through Kumbhak. Now, you can't change the environment. The second factor, I'll talk about 3 factors and then we'll go towards the question answer session. We'll tell you a little about the course. So the second factor, with every chemical, you get a side effect. You get an adverse drug reaction in the body. Right? Now, it doesn't happen with just chemical intake. It happens with the deviated food intake also. It happens with the deviated environment also. Now, you can't change the environment overnight. You should start changing the environment today. It will take 200 years. So what you should build is your tolerance toward a deviated environment. To build a tolerance toward a deviated food. To build a tolerance towards the adverse drug reaction. If you are tolerant enough, you will get less damage in the body. You can reduce the damage. You can reduce the adverse drug reaction. You can reduce the impact, the side effect of those things, isn't it? So how do you tolerate things? Now suppose you lift a 10 kg weight. You lift a 10 kg weight. How do you lift it up? How do you tolerate it? You hold your breath, isn't it? Can you lift any weight without holding your breath? No. The more weight you have to lift up, you'll have to hold your breath more. So you tolerate things by holding your breath. Suppose you have to now lift 20 kg weight. So you have to hold your breath even more, isn't it? How do you tolerate weight? 10 kg weight? By holding your breath in a certain proportion. Now if you have to lift 20 kg weight, you will have to hold your breath even more. Are you practicing it? No, you are not practicing it. You are not doing Kumbhak. So how will you ensure that you do the risk in your life, the future risk gets reduced in your life? How can you ensure then? if you do not improve the tolerance of this body, by taking medicine, you will land up in a hospital one day. That is for sure. And the organ damage will happen one after another. You have to ensure that you tolerate the wrongs, the side effects of whatever we are consuming at this point of time. Not only consumption, but the environment also. So if you have more tolerance, you will be saved. Otherwise, there is no chance. Right? Second part, I have told you. Tolerance. That's how your future risk and the tolerance to all the wrongdoings will increase. You will get less damage. Okay. So, metabolism you have to improve. Kumbhak will improve. Tolerance you have to build. That Kumbhak will do. Third thing. What is the greatest weakness in your body which has created all the damage? Do you know it? You actually don't know. What all your diagnostics do is basically measure the symptom that is happening. But why the damage happened inside the body, nobody can actually scan it, diagnose it, do any test of it. The diagnostic system, the current diagnostic system cannot even tell you 1% of the total things that is happening inside the body. So it is insufficient. We have to do some other kind of diagnosis which can tell us the root weakness in the system and work upon it for a faster result. So that is why we do the world's only Prana Shakti diagnosis, which actually diagnoses the weakness in the functional capacity of human body, a particular functional capacity. So we tell you to do a little experiment with your breath, with a little experiment with your body and emotions, and fill up the form. Those results actually help us to come to a conclusion of what functional aspect of your body has become weak, because of which you have got into a particular problem, and then the other problem also came along. That is what we take as a basis to customize your module. We teach you a generic module. All of you will be taught a generic or the same kind of a Kumbhak module, and after diagnosis we will customize it as per your body. So everybody's Kumbhak module gets customized according to the problem the person is facing, because all of you don't have the same problem, isn't it? You have all different problems, and it has progressed into multiple issues also, but something might have started first. So we do a diagnosis, a different non-invasive world's only Prana Shakti diagnosis, which actually tells us the functional weakness of your body. Right? We don't test ingredients. We don't test levels. We test the functional weakness of your body. And we customize the module according to that, so that you get a faster and a better result. So pressure I talked about is one thing through which you do action. The temperature of your body also has an ability to treat you or and keep you in a better health. That is called as Pitta pressure and temperature actually does the material management of your body. So pressure is called as vata. Pressure also generates or regulates the temperature of your body. So it is called as pitta, the temperature factor. And the third factor is kapha, which is basically material management, which happens because of pressure and temperature. So this is vata, pitta, kapha. The most powerful way to correct vata, pitta, kapha is regulating the pressure. You can regulate the pressure by breath hold only. There is no other way. So we control the vata. The vata is controlled by pressure. The pressure also regulates the pitta, temperature of your body. So vata, pitta gets control. Vata, pitta together controls the material management, the kapha factor in your body. The regeneration, degeneration thereby gets into balance. Right? So just by two factors, regeneration, degeneration, I have explained how it can be corrected and what are you doing to correct it, what is the right approach, what you are doing, how it is a wrong approach. You can take a proof of evidence of the numbers, the data of people into disease and how much it is increasing day by day. From there you can have the evidence of what I am saying. And you also know it through your own experience. So the experiments that we did, it's all into your experience. So we have to look at the health of humanity from a completely different perspective to actually reverse it, come to a state of health and happiness. Right? I'll stop here.
Thank you so much for listening to Swami Ji patiently. Now, I would like to request Manju ma'am to please share her journey. I'll just give a brief introduction of Manju ma'am. So she's just a sec. Manju ma'am.
She is spotlighted already.
Okay. So namaste, Manju ma'am. Thank you for taking
Namaste.
time out to join our webinar. So she is an internationally published author, TEDx speaker, and she's an award-winning life coach recognized by the London Book of Records. And she's also the board directors, Lions Club of Pune Harmony, the world's first all-women Lions Club. So a very, very busy person, and I think we are really grateful to her that she joined us today for the webinar. So, ma'am, could you briefly tell us when you started, what were your health issues and how you came out of it very, very smoothly by doing Ashtaang Chikitsa? What were the doubts in your mind? So,
Namaste,
if you could just
everyone.
enlighten our participants. Yes.
Namaste, everyone. I was introduced to Ashtang Chikitsa from one of my spiritual guide. She is into Kumbhak practice for a very long time now. So she is an homeopath doctor, and because used to consult to her, and my issues were reoccurring. So that means certainly my body was in such a condition that few things were just reoccurring. Like back in just 10 years back, I was diagnosed with cyst in my ovary. Then I had L4, L5 disc bulge out, and there's so many things followed. And eventually, 2 years back, I was diagnosed with an autoimmune condition called Sjogren's, which had symptoms like connecting tissue disorder on my body, and I had flare-ups on my body, which were recurrent, and it was not going off. I was on steroids for 1.5 years, and as just we heard that, as Swamiji said, that steroids we cannot take for lifelong. And I was already on steroids for 1.5 years, and doctors had told me that I have to continue the steroids if I have to control my autoimmune condition. This is one my Kumbhak. I was introduced to Kumbhak just 2 months back, and with my autoimmune condition, I had dry mouth symptoms. I had poor vision. I used to wear glasses. Within 15 days of practicing Kumbhak back when I started in June, within 15 days, my specs had gone. I didn't need specs to read. I could view. To distance vision was fine, but reading glasses were there, which just disappeared in 15 days. It was a miracle, and immediately in 15 days I texted in the group that this is happening, and everyone was thrilled, and it was motivating to myself, and it was motivating to others also. I and since I have crossed 40, so I was also told that after 40, whatever number you get, you have to be with those number, and you have to wear glasses. And this has turned, this has changed for good. I don't use glasses for reading anymore. This was just a basic thing, that very minor thing that happened. So many other things changed with. I became so aligned from inside as well, with my food, choice of food, my fragrances, and how I eat, what time I eat. There was an internal shift in my body. And being a life coach, I was not able to do this discipline in my life in the longest time. And after I was introduced to this course, I got so disciplined. uh, Kumbhak became like my steroid of life. As I used to take steroid every day, now I'm not on steroids. So I cannot live without practicing Kumbhak. I feel that I have skipped such a sacred practice in my life. And when you get into I cannot put it in words. It is just an experience. When you start practicing, it is just your personal experience, and everybody is going to have a different experience, because with all my batch mates, when I discuss, they all have that different experiences. You experience a different level of agility, flexibility, and so refreshing it is. You don't feel tired. I used to get tired by 12 noon, and now I'm all charged up until 3 4. And then there are few more specialized techniques that were given to me, and those are specialized to me after my Kumbhak journey course was over. And it just turned my life. I trust me, this cannot be put in words. It is just for your personal experience. I can only say that it will bring back to your natural self, your authentic self, that you are supposed to be without medicines, and without any external support. It's just your breath. It feels very tiny that a breath technique can change life, but yes, it is my personal experience that just the way how you breathe can change your life, and it does wonders in so many ways. And thank you, sir. Thank you, Guruji. Thank you, everyone. My guide who is mentoring my session. It has been life changing, and I I will continue to practice this all my life. It's just 2 or 3 months, and I feel a different person. So it is, it is recommended for all of us. It is a natural way of living that is being taught. It is nothing fancy. It is just how we should be. Thank you so much.
Thank you so much, Manju ma'am, for sharing your journey. So Swamiji has joined in, so we will take up the questions, and after that we will share the online program details. So, and Suminaran sir, who has joined us for another testimony. Apologies, sir. We'll take your testimony post the Q&A. Namaste, Swamiji. Good afternoon.
Yes.
Okay, participants, you all can put your questions there along with your name and number so that we can connect with you. If anybody wants to ask their question, you all can please unmute and ask your question. Raise your hands. OnePlus, is it yoga?
So fundamentally, you need to understand there's a difference between, there are two ways of energy flow in the life. One is downward flow, which is called as samsara or the worldly matters. And the upward flow is called as yoga or spirituality. So what we are doing is basically improving your life. We don't want you to get into samadhi or moksha or enlightenment. So it is not yoga. Completely opposite to yoga. It is more Ayurveda. The Kumbhak that we are teaching is more oriented towards Ayurveda.
Pranam Guruji.
Okay.
Guruji, I have this L4, L5 and osteoarthritis and BP. But once I start this Kumbh, you teach us how much fast we see the result that I continue like this, whatever you teach us then. How much time it will
First
take to
of
see
all,
the
you need to ask this question: will you be ever be able to get out of your blood pressure, arthritis, and this
No, I have
situation?
the belief now, what you taught us just now,
No, no,
whatever
no.
you...
You need to ask this question by taking medicine, how fast you will
No,
come out of your
no,
problem.
sir.
So give me one example in the last 100 years who has come out of the problem by taking
No, no,
medicine.
sir.
Any BP
Nobody
patient?
has come
Have
out.
you met any BP?
Just
Nobody has
maintaining it.
come out. You are no. You are not maintaining it. Your life is going down the drain.
Sir.
Believe me. Just create a complete analysis of people who are taking medicine, who are not taking medicine for their problem, and you'll see people who are taking medicine, their life is almost like
Yes, I can see my
it's going
life
down.
only. Not good.
Yes. So when you ask this question, how fast I'm going to recover? So I want to also consider asking yourselves, who is that person who tells you that you are happy or sad?
Myself only.
Who is that person who tells you that you are in pain?
Myself.
Who is that parameter or gadget which tells you that you are low in energy
Myself.
or high in energy?
Myself.
Who is that gadget which tells you that you are more enthusiastic in doing your work now? Who is that gadget which tells you that you are sleeping well or not sleeping well? So who
Everything
will tell you?
myself.
It is your body which will tell you.
Yes.
The moment you start doing Kumbhak, the first thing that you will notice is high on energy. Now tell me, any discrepancy, any disease, any difficulty, how the body recovers? By spending energy, isn't it?
Yes, sir.
Recovery is also done through energy.
Yes.
So we have done the world's first scientific experiment correlating Kumbhak with mitochondrial health. Mitochondria is the powerhouse of your cell.
Okay.
And we have found that 4 weeks of Kumbhak improves mitochondria health drastically. So, and we are telling you from the first day you'll start feeling more energy. That means if your body starts gaining more energy, the recovery strength will increase. How your body recovers will increase.
Okay.
So your recovery will be faster. But then always look for symptoms rather than some number in a gadget. If you have whatever blood pressure, if you don't have a symptom of blood pressure, your body is fine. So there are people who will crash because their blood pressure has gone to 250, and there are people who will not crash even if their blood pressure goes to 350. So it is not the number which decides what problem you will have. Because with the same number, 10 people do not get into same problem. They get into different problems. So what number are you looking at? Now, one thing is guaranteed: if you start doing Kumbhak, with whatever number you get on your gadget, you will not get into crash. Do you want this state? So you will have to do Kumbhak. There is no other way. You'll have to increase or improve the tolerance of your body. If your tolerance of your body improves, whatever number you get, it doesn't matter. You'll not have to go for a knee replacement. You will not have to go. You'll not get into heart attack. The blood pressure will not create any problem for you. And slowly and steadily, we'll see the numbers also. According to your need, it will come down to number that your body needs. There are lot of things which we need to consider. Whatever narrative has been put in front of you, you simply has to ask a question: has this narrative helped the humanity or not? So when your doctor says, this is not right, you should get.
Swamiji, please unmute yourself.
You need to
Please
ask
unmute
this
yourself. Yeah.
question. You need to ask this question. Doctor, have you made anybody come out of blood pressure issues? You need to ask this question, how many people are getting into heart attack nowadays compared to 50 years back? Is blood pressure increasing in the world? Is heart attack number one cause of death? Yes, we have made it. So is arthritis increasing in the world? Even youngsters are getting into arthritis. Is metabolic issues increasing in the world? So whatever narrative has been put in front of you, that narrative is absolutely not working. It's wrong, completely wrong. So how fast you will see result? As fast as the first day itself. The moment you start doing Kumbhak, you start getting result. But to establish that result in your body might take time, and the time may vary from people to people. But one thing is for sure, you will go towards reversal. There is no other thing in the world which will reverse your disease. Your body can only reverse your disease. Not even Ishvara comes, God comes, he will not be able to reverse your disease. It is only your body which will reverse your disease. You just have to empower your body.
Annie ma'am, have back issues and upper spine near the neck and vertigo. Need help a lot for imbalance and vertigo.
See, there are certain characteristic of a person, of a particular person, which decides that what kind of issues that person will get into. If I go too much into technical detail, you'll actually not understand anything. But let me tell you in a very, very simplistic manner. There are basically three things which I described: Vata, Pitta, Kapha. Vata problem happens below your hip. In a very simplistic manner. Pitta between the hip and chest region, and above the chest region, Kapha problem. So if you are getting into cervical issues, if you are getting into any issues related to balancing problem, it has a Kapha factor associated with it. The second thing is you are also getting lower back pain. Lower back pain can happen because of three different factors. One, if you are a Kapha person, your weight is a little more, then what will happen? The weight of your body actually comes onto your hip and you get into lower back problem. Now, this weight is also correlated with Vayu dosha. If you get into Vayu dosha, especially if you are in a rainy season which is rainy, then you'll see a lot of pain factors will increase in the body. So it is called as apana dosha. If you are constipated, your bowel movement is not proper, you'll see you'll get into lower back problem. If you do not have strength, females who get into menstrual cycle, they get into lower back problem because the downward moving energy is increasing and it has to be balanced with the upward moving energy, which is called as udana. If you don't have higher udana, then there will be depressive tendency, weakness, procrastination, lower back pain. Those things will happen. So what is the solution? Improve udana factor. That means upward moving energy. So we do special kumbhak for that. Now, apart from that, as I said, you get into Vayu dosha, you get into lower back problem. That means if you are constipated, relieve your constipation. If you are at the time of periods, that means you'll have to work upon yourself to enhance your energy, overall energy, so that when period comes, if you are doing Kumbhak, you'll see the painful periods will subside. The painful period will not no more remain painful. So if you prepare your body, it can handle the special situation which happens. Apart from that, if you are a kapha person and you have cervical issues as well as lower back issue, just remember that you have weak metabolic heat. The ability to digest food is less because of low metabolic heat. So those kind of people will also get into acid reflux. Whenever they eat, acid reflux happens. The hunger factor, the hunger quotient is also very low because of weak metabolic heat. So if you improve your metabolic heat, which otherwise you can't do by taking any medicine. In fact, by taking medicine, you have come into weak metabolism. So it will not improve by chemical medication. How many of you will put diesel in a petrol vehicle? How many of you will put diesel in a petrol vehicle? Nobody. But your body was not designed for chemical consumption. How come you are putting chemicals inside your body? We have even lost the common sense that we used to have. So don't think if WHO says something, it says right. Please understand, WHO is not an intelligent body. It's a concrete body. There is a building, nothing else. So you are more intelligent than WHO and any damn scientific community. Because your body knows how to survive and live. Nobody else can actually help you into that. So if you understand it through simplistic means, you will see that there are solutions to whatever problem you're facing. And if you think that there is a pill to every ill or illness, you have lost your common sense. Right? So Kumbhak increases, improves metabolism. That's why if you do Kumbhak, your hunger factor will improve. You will be able to digest food that you earlier you were not able to. Your regenerative factor will improve. The detox factor will improve. And you'll see, you'll come out of all these issues.
Dona
Okay.
Mendonca, Kumbhak is breathing practice, sir.
Kumbhak is breath hold practice. It is not breathing practice. But because we put certain breath hold numbers, the inhalation and exhalation factor also needs to change or adjusted. So we adjust inhalation, exhalation also, but then the primary thing which will actually work inside you is breath hold, not breathing. The strength of your breathing is in breath hold. The strength of your hunger is in how much you can fast, isn't it? Not eat. So similarly, the strength of your breath is how much you don't breathe. How much you don't breathe. Yeah, that means you hold your breath. So Kumbhak is breath hold practice, but in that breath hold, there are permutation combination of inhalation, hold, exhalation, hold, and there can be millions and millions of Kumbhak looking at the permutation and combination.
Aditi Johuri, ma'am, I have accidentally found out that I have patches in my brain which indicate multiple sclerosis. They have recommended for lumbar puncture. No major symptom right now. Can this help me in this situation?
Yes, of course, it can be helped. In fact, see the patches we have seen patches in the lungs which become fine by doing Kumbhak, and patches in the lung, it doesn't go by any other mean. So we have found that people who get into stroke condition, even stroke condition, if they are doing Kumbhak, they don't need hospitalization, and the stroke condition also become fine. So the patches which basically are there anywhere in your body, it indicates lack of transaction, lack of movement through that part. Necrosis can also be one of the reasons. Necrosis means the cells are getting dead. So what we have found by doing Kumbhak, the cells revive. Lung cells have revived. Neuro cells revive. And it can be helped. Otherwise, multiple sclerosis, there is no treatment for multiple sclerosis. Let me tell you clearly.
Okay. Shriyans have varicose veins since 3-4 years. Moreover, I have sinus since many years, due to which I have headaches. Can you please suggest?
See, if you come with different kinds of problem, what you need to do is put your number down. Because if you just have a sinus issue and a varicose vein issue, a headache or sinus, which is major for you, then we'll see which program actually will be most beneficial for you. So if you put your number, we'll take a little more information from you and will guide you to the right kind of program.
Anybody from the participants who would like to ask a question? Anila Devi, ADHD, depression and panic attacks also will vanish, Guruji.
If you have neuromusculoskeletal problem, along with those problems, of course, that will also get help.
So she also has sleeping disorders with rheumatic and diabetic. Can it be cured? Anila Devi, ma'am.
Multiple issues, put down your number. We'll see which will be the most beneficial program for you.
Okay. Renuka, ma'am, Dubai, slip disc in neck due to injury leads to nerve impingement and pain and numbness in arm part from neck. Can it be cured?
Yes, and this is the right program for you.
Okay. Christina, after brain surgery, I also have panic attack.
After brain surgery, panic attack, but then you will have to do rehabilitation after brain surgery that you didn't do. So Kumbhak is also a very powerful rehabilitation method. It will help you to completely come out of your panic attacks.
Hombala, my name is Hombala, having eye twitch issue since right eye side and right side head heaviness issue. Please advise me how this treatment will help me.
It is a neurodegenerative disorder. There are certain nerves which have degenerated, and because of that, you are getting into this condition. Kumbhak will help regenerate nervous system. For that, you can type on the
I
Google.
finished. I'm coming.
On the Google, you can type
But I
neuroplasticity.
have to correct it, right?
Can we have some silence, please?
So neuroplasticity, which will give you a little confidence that neurons can be regenerated. The second thing that you have to type is stem cells and find out about stem cells. Stem cells are those cells which actually regenerate your organ and tissues. Now you need to give a trigger to the stem cells for the regenerative purpose. Kumbhak is the trigger to stem cells, which will help increase the regeneration in your body, and thereby you will see over a period of time, you can come out of it completely.
Okay. Kaniza, ma'am, my husband suffers from drug-induced Parkinson's. Will this help?
We also run a Parkinson program. If you do this program first and then go for a specialized program, that will be most beneficial. Otherwise, you can also join Parkinson program.
Rajneesh K, does
Mm.
taking of vitamins and supplements also affect the immune system, and is it same as other allopathic medicines?
Yes, there has been extensive research on vitamins and minerals, and it has been found that excessive vitamin and mineral in your body actually hampers the hampers the regenerative factor of your body. Thereby, it can also lead to cancer. So, any kind of a supplement which is synthetic in nature, not natural, is not conducive for the body. Will it help in a shorter term? But as I said, your body is designed to consume only those things which it recognizes, which occurs naturally, organically on earth. So anything which is not natural and organic in nature will always create some kind of a deviation and discrepancy in your body. It is better that you improve the absorption and metabolism, and your body is designed in such a manner, it is like equipped in such a manner where it can extract everything it needs from the same kind of food if you give it throughout life. Like, for example, just think about your ancestors. They would not get the kind of food and supplements that you are getting. But they didn't have that kind of deficiency in them. Not also the way we are entering into, we are getting chronic disease. They didn't have chronic disease. Just 3 generations back, they didn't have these kind of chronic disease. So that means the strength of this body to extract vitamins and minerals from the food that you eat has come down. Kumbhak is the strength through which the extraction, the metabolism, the absorption, the detox will improve. And you'll see, even with people who have lower uh, vitamin levels in their body, iron levels in their body, hemoglobin levels in their body, it will improve just by doing Kumbhak. If you want to take supplement, take natural organic supplements.
Saroj Rohankar, I'm 80 years old, severe neck pain, please suggest.
80 years old, severe neck pain. Udana Shakti is weak. Udana Shakti means what? Your breath hold capacity and the exhaling capacity. These two things have decreased. Improve it by doing Kumbhak, and you'll see it'll go off.
iPhone, since veggies and fruits contain pesticides and chemicals, isn't it required to take vitamins and minerals in supplement?
As I said, your body doesn't recognize vitamin mineral manufactured in a lab or a factory. So even if you take those vitamins and minerals, okay, let me ask you, give me one example of a person whose osteoporosis has become fine by taking calcium. In the last 50 years, nobody has come out of osteoporosis by taking calcium. So what is the use of taking that calcium? So what I am suggesting is, we will not say take it or don't take it, because we are not a vitamin supplement suggesting company. What we are suggesting is improve the absorption factor of your body, the metabolic factor of your body. By doing that, even if you don't take vitamin or take vitamin, whatever, your body will be able to extract whatever it needs. Second thing is pesticide, insecticide, all those veggies and fruits contain. So take this responsibility that we have done it. Why you are cribbing when you have done it? So who will change the scenario? We will have to change. We will have to demand something nice. If you don't demand nice things will not grow in the farm. So it's our responsibility that we have not left anything which is conducive to consume. That is what I said. The whole narrative and the education system has given us a wrong direction, which we have to change.
Okay, Renuka ma'am, you can ask your question. You want to ask something, please unmute and ask.
Pranam Guruji.
Pranam.
Guruji, slightly different question. If forgive me if I'm deviating, but it's very, I think, very important, especially for me. Talking of food, that so, Guruji, I have, without, I mean, most humble way, I want to say, not boasting, but I have become vegan currently because I saw a documentary on how cows are being treated, and see, I was anyway lactose intolerant for milk products earlier. But as being a South Indian, I used to enjoy my ghee and buttermilk, yogurts. But seeing the documentary, I felt wow, I felt very I felt like my tiny bit. I should not encourage this, and I have become vegan. But my question is, then I know that Ayurveda recommends ghee, and and for especially like digestion and all, yogurt is important, calcium and all, of course. So what is the way out, Guruji?
First of all, don't try to put any tag on yourself.
Okay.
Second thing is, if you become vegan and do not demand a good dairy, then you'll not find good cows after a few years. So we should demand right things. Please, we should demand right things. Because there is a demand in India, we have started demanding A2 cow ghee, A2 milk. And in India, you can find A2 cow ghee, A2 milk, which is a uh, desi breed cow, free
Yes.
grazing cow. And people have started doing that. So it's a demand on which, and because this is a so this is a general knowledge question also. We have not accepted America's demand of their export of dairy to our country because they don't rear their cows the way we rear our cows. So it is the demand which will help the cows. You demand the right thing, and you'll see beautiful cows, naturally, uh, native breed cows once again.
Yes, Guruji,
Now, the second thing is
sorry.
we will not tell you what to eat, what not to eat. First of all, if you do Kumbhak, your lactose intolerance will go away,
Yeah.
right? The second thing is, at this point of time, ghee is the most potent medicine available to humanity.
Mm. Yes.
It will help we have seen if we feed ghee to people who have high cholesterol, triglyceride, and fatty liver, their cholesterol level goes down. Their immune cells become strong. The nervous region, neuro region, new nerve is fat.
Mm.
So your brain is fat. That is why in India we feed children with lot of ghee. And people in difficult situation, like where nothing grows in Rajasthan, in Gujarat, where it's too difficult a situation. Ghee is the only thing which helps the human beings there. So natural occurring desi breed cow ghee is a medicine. Having said it, we will not force you to have ghee or any other thing. What we suggest is, first of all, do Kumbhak, your lactose intolerance will go away. Do Kumbhak, your allergic condition will go away. Do Kumbhak, your metabolism will improve, your hunger factor will improve, and the regenerative factor in your body will improve. So what we are emphasizing is whatever else you have an idea about and you want to do whatever will not stop you from doing that. What we only suggest is just empower your body. Just empower your body. And doing that, if choice comes in later years where you consume dairy product, and you can ensure at that time that you don't get into problem. If not, it's okay. If not, if you don't want to consume dairy product, it's okay. But instead of negating anything, I would always suggest that you demand the right thing.
Okay, thank you.
Okay, anybody from the participants who would like to ask a question?
May I ask one more question related to Kumbhak?
Mm-hmm.
Yes,
Guruji,
yes.
yes, thank you, Guruji. Guruji, is Kumbhak similar to pranayam?
See, pranayam is a very wide umbrella. Pranayam is a very wide. Prana is something which everything in nature has. But because the text has been classified into two categories, one is Yoga Kalachara and the other is Ayurveda Samsara. In Yoga Kalachara, everything is directed towards Samadhi, Mukti, Moksha, enlightenment. There also, Prana, the direction of Prana is actually headed towards Mukti, Moksha, Samadhi, enlightenment. We don't want to give you those things. So, pranayama or giving a direction to prana. When you speak, you are doing pranayama. When you see something, it is pranayama. When you smell something, it is pranayama. When you listen to something, it is giving direction to your prana. So, any activity of your life actually is a pranayama. But before categorizing it into yogic pranayama and non-yogic pranayama, you should understand this factor. Giving direction to prana is pranayama. Yogic pranayama gives direction to the prana towards mukti. Sansaric pranayama or Ayurvedic pranayama gives the direction of prana towards life. So what pranayam we are doing? We are giving the direction of your prana or life force energy towards living life beautifully, not going out of life. So there is a difference between yogic pranayama and sansaric pranayama. We are doing sansaric or Ayurvedic pranayama, not yogic pranayama.
Okay, Guruji, but is it similar to Kriya Yoga in any way? I have not done
No,
Kriya
not
Yoga.
at all. 180-degree opposite. 180-degree opposite. East and west, south and north. That kind of opposite thing it is. Kriya Yoga is towards mukti. Our Kumbhak is not towards mukti at all. It is towards health.
And Guruji, can it be taught online? Because I live in Dubai. So,
That is
what
why
is-
we are conducting the webinar online, because it can be taught online.
Okay.
All the classes are online classes.
Okay. Okay. Thank you, Guruji.
Okay, Sapna Pankal, ma'am, diagnosed with endometriosis, can it be reversed?
If you want to conceive, if you want to go towards conception, put down your number, we will guide you to the right program.
Okay. Baba Saheb Patil, can pranayam and kumbhak be done one after the other in daily routine?
We'll tell you the sequence. Because first you do the Ayurvedic thing and then the Adhyatmic thing. Yogic thing. Yogic thing has to be done in the last. So we'll give you how and when it can be done.
Okay, anybody else from the participants who would like to ask their question can please do so.
No, you'll have to unmute.
I'm living in Abu Dhabi and I want to know about the timings because there is a time gap living here in UAE. So, will the time suit us and about the details of the course? How do I know what are the
Just
details?
put down
Like,
your number in the chat box. Put down the number in the chat box. Somebody will get in touch with you and discuss the timing
So we
information.
will be sharing the details of the batches. Hereafter, we'll be sharing the online program details. After we are done with the Q&A, you'll get to know everything. So please remain in the group and you'll get to know the details about the program, the timings, the fees, etc. Everything you'll get to know. It's a totally online program. So you can attend it from anywhere.
okay,
And we have done the time according to the Dubai time that will suit you.
okay,
So right
okay,
now, since we are doing the Q&A with Swamiji, please ask your questions. We have limited time with Swamiji.
okay. Thank you. That's all I wanted to know.
How
Okay.
long? Can I
This is
ask you? Hello, can I ask one question?
Mm-hmm.
Hello.
Yes, please go ahead.
Go ahead.
How long and how it is to be done actually, Kumbhak?
So
It
we'll
How
let
much
you
time
know
we
on
should?
that.
Mm-hmm.
We'll
नहीं,
let you know on that.
मेरे ख्याल से आप वो प्रोग्राम के बारे में बता दें ताकि
हाँ, हम लोग प्रोग्राम के बारे में अभी बताते. Thank you so much, Swami Ji. So over to Anil Ji to please share the online program details.
Swamiji, can I ask you one question?
Yes.
Yeah, so I have bunions in my foot. Like दोनों पाँव में मेरे bunions हैं, which makes it very difficult for me to walk at all. So, and I'm very like person who goes around like quite a lot. Travel बहुत करती हूँ मैं. So will this Kumbhak help me
हाँ,
with
Apana
the
dosa.
bunions?
Yes. Kumbhak will
Sorry,
help you in this. Kumbhak will surely help you in this. It is Apana
does it
dosa. It is
cure?
called as it is called as Apana dosa, and it will go off after a certain period of time if you do Kumbhak regularly.
Okay, so it can be cured. Like I don't want the
Yes.
management thing. Like जैसे doctors
No,
बोलते हैं
no,
कि
no.
manage किया जाएगा. Manage नहीं करना है. Cure है.
मैनेज नहीं करना, ये क्योर हो जाएगा.
Ji, thank you so much.
ठीक है? Okay. Okay then.
Okay. So now Anilji will be sharing the online program details with the participants.
Thank you, Rachna ji. Give me a few seconds. Okay, so let us know about the Ashtang Chikitsa online program details now. A lot of people are waiting for this. First of all, this is a guided program which is conducted online by trained Kumbhak mentors. These mentors are trained by Swami G himself. So they'll be the ones who will be taking these classes or conducting these classes. And there are 3 modules in the program, the Vata, Pitta and Kaph. Duration of each module is 3 weeks. So 3 weeks into 3 modules makes it a 9-week program. Now you can see there's 1 week extra that has been added, 9 plus 1. So it becomes 10 weeks. Why 1 week has been added? That we'll also talk about. There'll be a total of 18 classes. 2 live classes will be conducted per week for 9 weeks. Out of these 2 classes, one is called the main class and the second one is called the practice class. What is the difference between the two? That we'll discuss shortly. What are the next steps? You pay the program fee and there's a special group fee that we'll be announcing for people who are attending it live. After that, you'll be filling up a participant onboarding form so that we can create login credentials for you to access the course. These are the recording of the previous classes that you'll have access to. Then you'll be starting your classes with module 1. After completing module 1, you'll be going to the next module, module 2 and module 3. All 3 modules have to be completed one by one. Then all the modules have 6 classes each. So 6 classes into 3 modules becomes 18 classes. But there's one customization class also. This customization class, we'll learn what this is and we'll talk about it in detail after some time. So there'll be a total of 19 classes. What is the class start date? 6th September, Saturday. This is a weekend batch. The classes will be on Saturday and Sunday. At 7 a.m., this is Dubai time. For people who have joined from Malaysia, Singapore, for them it will be 11 a.m. And for people who have joined from Indonesia or Thailand, their time will be 10 a.m. We'll share all these details in the WhatsApp group also. What is the class experience like? These are live sessions, as you must have understood by now. Just like you are attending this session on Zoom, in the same way the classes will be conducted. Mentors watch all the participants, how you're doing your practices. So it will be compulsory to keep your camera switched on during the classes. Then there'll be written instructions in English and Hindi, and session recordings will be provided. These are recording of the live classes. Then there'll be a lot of extra things like metal practices will be there. You'll get a unique diet perspective. Mind you, this is not a diet plan. There are no diet plans given in this. You'll get a video from Swamiji in which he talks about how to use food in a way that it supports the body and not harm it. And there are no dietary restrictions at all. Many people ask us if they have to eat a certain kind of a food, or there are a lot of people who eat non-vegetarian. They ask us, do they need to stop? You can continue having the kind of food that you're used to eating, no dietary restriction at all. Then there'll be simple detox processes, and a lot of knowledge will be shared during these 9 or 10 weeks that you'll be with us. Before I share more details, it's very important to know who this program is not for or who all will not be able to do this program. This is not for people who are looking for a magic pill and want results tomorrow only, because what we are talking about is reversal, long-term solution or a permanent solution. So if you have something in mind that some kind of medicine will be given, no medicine is given. On the contrary, this program can get you out of your medicines, whatever you've been taking for so many years. And this is not for those who are not ready to work on the body, because you'll be required to invest 45 to 60 minutes every day to do your daily Kumbhak practices. If you do not have this kind of a time, then also you won't be able to take advantage of this program. And this is not for those who are impatient, for anything that takes a little bit of time, because it's a long-term or a permanent kind of a solution. So patience has to be maintained. If not, then you know what will happen. And this is not for those who are looking for a free treatment or just some tips, because this is to be done under the supervision of experts, under the guidance of Kumbhak mentors. So This is not a free program. And if you're just here for to pick up some tips, you must have noticed there are no tips being given, like a lot of other webinars that you attend, because the body has to be looked at from a different angle, from a different perspective. Because whatever, like Swamiji said, whatever narrative has been there created is not working at all. Had that been the case, there wouldn't have been so many problems, and the chronic ailments wouldn't have been increasing at such a alarming rate. So tips doesn't help, because if tips would have helped, you would have already solved your problem, because there are thousands of people online and YouTube giving so many tips, but doesn't work that way. Let's talk about what all you get in the program and how the program works, how you get support. Uh, we'll talk about the first point, which is Pran Shakti diagnosis, and this is the magic of this therapy. Because through this diagnosis, Swamiji is able to determine the weak functional strength in the body or the root cause of the disease. And it's a unique diagnosis, one of its kind on the whole planet. Why do I say that? Because first, this is a non-medical diagnosis, and secondly, this is an online diagnosis. Now, both the things may sound very strange to you, because we've been used to going to a diagnostic center, getting some scans done, X-rays, MRIs, whatnot, stool sample, blood sample, urine sample, but none. We do not take levels. We do not measure levels to this. So let me explain how this is done and how this is very unique. You'll get a link to a form and you'll be asked to do some experiments on your breath and emotions and note the observations in the form. Second, you'll be writing about all your health issues in detail in the order that they occurred in this form. And third, you'll be asked to upload a selfie photograph, shoulder and above, in which the face should show very clearly, but there have to be no specs on the eyes, and in case of ladies, no makeup also. When these three things reach Swamiji, he is able to determine the weak functional strengths in the body. There are 84 forces through which the organs and this whole body works. Which force has become weak, due to which you have landed in your current health issues? This Swamiji is able to determine through this diagnosis, Pran Shakti diagnosis. Then there'll be weekly one main class of 40 to 45 to 60 minutes. Weekly one practice class. What is the difference between the two? In the main class, first, the mentors will demonstrate how a Kumbhak practice is to be done. Then, in some of the classes, Swamiji's videos may be played for more knowledge, for making things better, for making things clearer to you. And in the end, there'll be some time left in which you'll be doing some practice. And as the name says, the practice class, you'll be practicing in the total duration of the class. That's the difference between the two. You'll have access to the recording of the live classes for 3 months after the 10 weeks are over. You'll be able to make notes. You can play again and again and see how a Kumbhak practice was done, how it was demonstrated through these recorded sessions, which you'll have access to. Then videos of all kriyas done in the class. These will be small videos of each Kumbhak practice. The 45 minutes or 60 minutes duration of the whole class, that recording, you don't have to watch that just to see how a Kumbhak practice or kriya is to be done. You just play that video, small video. It may take 2 minutes to watch, 5 minutes to watch, and you'll save a lot of time that way. Then there'll be written instructions which you can download and print also. And these will be very useful. These will come very handy when you're traveling or when there's no internet, because when the internet is low or when there's no internet, the videos may not play properly. But these written instructions will help you a lot that time. Then this is the most important part of the support system that we provide. As I told you, there'll be 2 live classes per week. The remaining days of the week, you'll be required to practice on your own. And while practicing on your own, if you have any doubt, any questions, you'll be able to ask them in this group. Our mentors are there in this group. They'll be answering all your questions. They'll be clarifying all your doubts, and they'll keep guiding you in a step-by-step manner. Then individual participant progress tracking and feedback after every module. Like there are 3 modules in the program, the Vata, Pitta and Kapha. After each module, you'll be filling up a short form. Through this form, we come to know how you're doing how your progress is going on. If And if somebody is not making any progress, we try to find out the reason. We try to find out if you're practicing as per instructions or not. We try to find out if you're doing the practices on a regular basis or not. So through this form, we are able to do that. Then therapy customization for each participant in the 10th week. Please pay attention to this point because this is connected to the first point. Do you remember the first point? Prana Shakti diagnosis for root cause determination. Now, the Prana Shakti diagnosis is done in the first week of your enrollment, but it will be used in the 10th week. Our question arises, if the diagnosis is done in the first week, why the practices, the customized practices are given in the 10th week? There's a reason behind it. Any kind of disease, and especially we are talking about neuro musculoskeletal problems, there's already organ weakness. And these customized practices are so powerful that if given in the first week only, your body will not be able to bear the impact of these practices, customized practices. So in these 9 weeks, your organ strength is brought to a level where when you practice these customized practices, you will be able to do them without any problem and get the benefit out of these. So that's why these are given in the 10th week. And everybody gets their own customized practices, even if the problem is the same. That's why everyone gets their own separate, different customized practices, despite having the same problem, because the reason of them getting into a problem can be different. That's why it's called customization. Then there'll be specially recorded audio instructions, which you can just listen to and do your practices. You must have noticed that there are a lot of support given. First is the class recording, then small videos of class, then you get written instructions. Now these are audio instructions because we want to make everything crystal clear. So there's not even 0.1% of doubt how to practice. Because it's an online program, we put so much of support due to that reason only. Everything should be crystal clear. There are program reviews and testimonials which you can go online and see. If you go to Google and type Avisa Healing and Fitness, you'll be able to see a lot of testimonials. And these are very long testimonials, most of them. Because people who have gained, they were suffering from so many years, still no solution in sight. And that's why they just keep wanting to write very long and detailed reviews. And just note that it's a average star rating of 4.8, which is considered very high. And if you go to YouTube and type Avisa Space Healing, you'll be able to see this green logo. That's our YouTube channel. You go to the channel and type on Ashtaang Chikitsa testimonial on the playlist. There are, as of date, there are 546 video testimonials. So just have a look what people have experienced and what kind of benefits and what health issues they got. There are a lot of testimonials. Extreme. And for your information, only 10% of people give testimonials because most of the people do not want to talk about their health issues publicly. So, which means there are thousands and thousands of people who are getting benefit through Kumbhak. So, what's the course fees? There are two formats that we have for these classes. First option is one-on-one personal classes. Second one is group classes. We'll talk about both of them. One instructor, one participant. That's one-on-one training. This is for people if the group timings do not suit them or if somebody needs more support, whatever the reason is. The fee for these one-on-one personal classes is 60,000 Indian rupees, 30,000 before enrollment and 30,000 after a month. If you pay in a single shot, this is Indian rupees 50,000. Now we'll talk about the group classes. There'll be multiple people, about 25 to 30 people are there in one class. So we are able to offer the group classes at a much lower fees. This is INR 21,000. But like I promised, that there's a special fee which we announce only in the live webinars. What is that? Let's see. Just Indian rupees 15,000. And this has been kept very affordable. So most of the people will be able to take advantage of this. These are in different currencies like dirham, it's 631. Kuwaiti dinar, it's 53. Qatari riyal, it's 6 to 7. Omani riyal, it's 66, 65 for Bahraini dinar. We'll share all these details in the WhatsApp group also. And then in Malaysian, Singapore, Hong Kong, all these Thai baht and Indonesia rupee, these are the figures, the fee for that. We'll share in the group and in the chat also, so nothing to worry about. Now I'll just recap what all is there in the program. First is the Pran Shakti diagnosis to determine the root cause of the problem. Weekly one main class, weekly one practice class, access to recordings of the live classes for 3 months, videos of all kriyas, written instructions, private WhatsApp group to ask your doubts and questions in individual participant progress tracking after every module, therapy customization, audio instruction. This is what you get. How to enroll? You pay the program fee. Then you post the payment receipt in the WhatsApp group. This is the same WhatsApp group where you got the link for this webinar. Then Neha from our team, she will send you the participant onboarding form link and class WhatsApp group join link on your personal chat. This is the same WhatsApp group where you get daily support. And step 5 is to start attending classes to learn Ashtaang Chikitsa, simple 5-step process. All these are payment methods. If you have Indian bank account, you can use the above one. If you're paying from international, you can use credit card, PayPal account, or a site called wise.com. You can do a bank-to-bank transfer through that. This is the world-class support that we have, which will make sure that you get success with this program. We have Rachna Srimar Bhutra. She's the program director and the host of this webinar. Shalini Bhagwat is the class manager. Neha is the enrollment in charge. Then IT manager is Ashwini. Then mentors, we have a full team. Anjana, Soni, Aruna, Neena, Meera, Sushma, Manvi, Anjali, Ganga, Arijit, Vivek. In technical, we have Sheetal. Sheetal is the person who will help you if you face any issues with technology. For example, if you're not able to log into your post dashboard where all the recordings are shared, if you're not able to download your written instructions, or if your videos are not playing, then in personal support we have Anita, Kavita, Mehak. They'll be calling you on WhatsApp, or they'll be interacting through messages to find out how your program is going on. If you're facing any problem, and if you are, then they'll give a solution very fast. WhatsApp admin Anil Chauhan, that's me. I, along with Ratnaji and Neha, will be answering your questions after this webinar in the WhatsApp group. Because due to limited time, although Swamiji took a lot of questions, but still some questions may have been left. If your question is not answered or not taken, please don't worry at all. Post the same question in the WhatsApp group and we'll answer each and every question for you. And here's an unbelievable 2 bonuses for fast action takers. Let's play some game. If you enroll by 7:30 p.m. today, which is 31st August, you get 2 super bonuses. One, instead of the 3 months, you get access to all the class recordings for 12 months, for a full 1 year. Second bonus you get is, this is really unbelievable, you get 12 months of live Zoom consultations after the program is over. What do these consultation sessions mean? Since there will be 4 sessions a month, and in 12 months, there'll be 48 live Zoom support sessions. A lot of people say that, oh, what will we do after the program is over? This you can take advantage of. And through this, you'll be getting an ongoing mentorship and accountability full 12 months after program ends. And like I said, this is limited. So we'll be able to offer only to people who are able to pay by 7:30 p.m. today. And this will be an expert guidance. You'll be getting answers, clarity week after week, even after your program is over. Right? All these I've talked about. How this is a no-brainer offer. I've put some numbers here that you get access to the class recordings for 12 extra months. So 2,400 Indian rupees. Then you get 48 live Zoom consultation, which I just talked about. If you price it at just 500 a session, it comes to 24,000. So the bonuses are actually worth more than what you are paying for the program. So you must have understood the value that this program is bringing you. through these bonuses and through the program itself. It's a completely amazing kind of a program. And yes, we've talked about this. Now is the time you can put an end to years of pain and suffering, like a lot of people, like thousands of people have already done, because medicines aren't helping, surgeries aren't helping, and you can escape the side effects of allopathic medicines. That's the biggest thing that one can do for oneself. And you can empower your body, because this body only can heal you without using any medicine. But the only thing that you need to do is give support to this body. And Kumbhak is that method through which you can strengthen this body and make this body uh, resistant to the problems that you may have, and become tolerant to any disease, any chemicals that being putting inside this body. And so we invite you to enroll and get benefited by this amazing therapy. If you get questions, Swami Ji answered a lot, but if you still got questions, please post in the WhatsApp group and we'll answer each and every question. With this, I come to the end of
Hi,
my
Anil.
parts of the present. Thank you. Namaskar.
Hello.
Yes, please.
Hi, Anil. This is Ramya. I just have a quick question. Actually, in group class, right, whatever the pointers that you have mentioned to what you get, right? So, how these are individually customized as per their problems, how these are going to be addressed in group class?
See, you get your customized practices in the 10th week, and there'll be one extra class to explain your customization in that class. And that customized practices that you get, that you have to follow from there on.
Okay, so the all the remaining classes are same for everyone.
Same, yes. First 9 weeks will be common for all. And in the 10th week, you get your customized practices. You get one class in which your customization will be explained, and then continue with that.
Okay, thank you.
Yeah, welcome.
Hello.
Yes.
Yeah, I'm still not clear about the timings and the sessions. Like if I'm on vacation, can I miss the classes and join again? And suppose I miss one class, can I join the other group? These things I want to, because earlier I did some courses where I had the options to, if I miss the morning class, I can join the evening class like that.
Ma'am,
Are there options?
Ma'am, can you leave your number? We'll connect with you personally and explain everything to you. I think that would be better.
No,
Yeah,
I
I
think we can
have.
we can explain here only, because for the benefit of others also. See,
Yeah.
as of now, there's only one batch which starts at 7 a.m. Dubai time. Now, if you miss any class, the recording will be provided. And since there's no other batch, there's no option to join another batch. Had that, even if there are different batches starting, but they start at different timing and different dates. So whatever is being covered in one batch will be different in the second batch. So it's not practically possible, but you get recordings. And as I told, that you'll be added to a class WhatsApp group for daily support. Like a lot of people who join from the US, and they join us at different time, because currently we are not running any batch for them. They join the Indian time batches, so they're not able to attend even single class. So they refer to the recordings, and in case of any doubt, they ask in their class WhatsApp, and that's how they are able to do.
Okay. Because I want to join, but maybe I'm not free at 7 a.m. in Abu Dhabi. I have to send children school. So what to do now? I don't know. I want to join. I
There'll be
want to
two
pay today
days.
only. Pardon?
There'll be Since there are two classes only early morning, so if you can manage somehow these 2 days, and the remaining
Okay.
days you can practice as per your convenience.
It's weekend, no? You said 2 days.
Yes, yes,
Sorry.
weekend 2 days.
It's a weekend 2 days.
Yes.
Yes, yes.
Okay, let me think then. Thank you.
Thank you.
Also, yes, I wanted to know if you're starting any other batch besides the 6th September, because we are traveling for now, so I won't be available then.
So
Is this
right
the
now
only
we
batch
just
that you-
have this one batch. So
Hmm.
if you can, if you're in the group, we'll update you as and when we start another batch.
Okay, yeah, thanks.
May I ask a question, please?
Sure, ma'am.
Yeah, see, with due respect to you, your Swamiji, and also so many testimonials are available, you mentioned, which I will definitely go through. But my question see, we have heard of Kriya Yoga, we have heard of Pranayam. So, what is the source of this Kumbhak? What is the source of this knowledge? Can we please know?
Anilji, would you like to answer this
Hmm.
question?
Yeah, see, the Kumbhak that is used in this is a part of Ayurveda. That's why we are talking about Vata, Pitta, and Kapha, and that's why there are 3 modules in the program. So, like Swamiji explained about Kriya Yoga, also, you asked the same question from Swamiji. So,
Yes.
though that, yeah, that is anything related to yoga. Yoga actually was meant for enlightenment, but the Kumbhak that is used in this program is a part of Ayurveda. There are 1,000 types of Kumbhak, and you can create new ones also. There's a ratio in which you inhale, hold, while holding, where all you will be focusing, because it's a combination of the definite count and a focus point. This is a part of Ayurveda, but this knowledge has been lost from Ayurveda. So Swamiji is reviving this knowledge.
Okay, so this knowledge is ancient traditional wisdom,
Yes,
just like
yes, yes,
maybe
yes.
pranayam and kriya, only that it was
Hmm.
not got hidden and got lost somewhere.
Yeah, whatever we know of Ayurveda is just herbs and medicines prepared from herbs, but that is just small percentage. If somebody is using Ayurvedic medicines and doing Kumbhak, it works like magic. So that's the basic difference.
Okay, thank you.
Yeah, welcome.
Anybody else from the participants who would like to ask their question can please do so. So Baba Saheb Patil, sir, Sunday's working day in Kuwait, any alternate day would work. Right now we have the weekend batch only, since most people are, feeling convenient because of the weekend. So one option is that you can use the recording and do the course. That is one option. Otherwise, you can stay in the group as and when we start another batch in the weekday. You can leave your number. We'll make a note and then we can inform you about it. Annie ma'am, price to guide to each module. So the price is 15K is for the entire module of Bath Pitta Kaph, each comprising of 3 weeks.
Can we see the slide of prices again? Sorry.
Sure. No worries.
Just give me a time. Give me a second.
Sure.
You can take a screenshot if you want.
Is this early bird, or this is even if we are unable to pay by today evening, this still holds?
Yes, yes. Only that 12 months of extra support is given as a bonus if you pay by
Okay.
7:30 p.m. today.
Okay, but the price remains the same.
Yes, yes.
Okay, okay. Thank you so much.
Yeah. Thank you.
So with this, we have come to the end of this webinar.
There's one question come up that will you prescribe Ayurvedic medicines? No,
So we do not
not in this program.
Not in this program.
If somebody wants, we can put you in touch with the Ayurvedic doctor and they'll be able to prescribe, but we do not do it ourselves. Rachna ji, I think we can end the session.
Okay. Thank you so much for all of you all who attended this session. So
Thank you.
happy Sunday. With that, namaskar.